Have you noticed that something looks off about a lot of men in Hollywood lately? Not older, not younger, just different, but not in a good way. I'm a plastic surgeon, and let me tell you why that keeps happening. The eyes are everything on a male face. The intensity, the authority, the presence, and it all depends on very specific anatomy. And that anatomy is a very narrow target, and it's easy to miss. So here are 4 pitfalls when performing periorbital surgery on men. Number 1, when too much skin is removed in an upper blepharoplasty. When the incision is marked too high, or when too much skin is taken, you end up with a pretarsal platform that sits way too high for a man. And you end up losing that low, full strip of lid below the fold. On a woman, a high crease can look elegant with makeup, but on a man, it creates hollowness and you lose that intensity of a male gaze. Number 2, ptosis. In some cases, it's iatrogenic, which means it's caused by the surgical procedure itself, but in others, it's a pre-existing ptosis that is often missed by the surgeon, and so it wasn't corrected at the same time as the eyelid surgery, and worse yet, it gets accentuated by the surgery. Either way, the eyes just look weak, lazy, and asymmetric, and it's hard to unsee. Number 3, aggressive midface filling. It's interesting because some research has shown that a negative midface vector, meaning the midface is sitting slightly recessed compared to the eyes, reads as more attractive and masculine in men. And by overfilling it, like in some of these male celebrities, you end up getting this unnatural tautness and feminized proportions. I think in men, less midface is almost always more. Number 4, too much brow lift. The ideal male brow should be sitting at or just overlying the orbital rim. It should be flat, heavy, and no arch. The heaviness is actually not a flaw, and it's not unattractive in men. By over-elevating it, it adds an arch when there wasn't one to begin with, and suddenly the face looks surprised and feminine. I think a low brow on a man is usually not a problem to solve. If you're considering periorbital surgery, ask your surgeon, how much skin are you cutting? And can I see the markings before surgery? Do I have pre-existing ptosis, and will it be fixed during surgery? And if they're recommending volume or a brow lift, ask them how much are they going to lift, or how much volume are they going to add, and why? One more thing. Upper eyelid surgery looks deceptively simple, but it really isn't. The margin for error is in millimeters, and those millimeters matter. So make sure you find a surgeon who does this regularly, who understands the male anatomy, and who will show you the markings before you go under. Do not treat your eyes as an afterthought. Make sure you find someone who can restore but not distort.